Order. Order. We now come to the motion on the National Health Service, and I call the Minister to move motion number 6. Helen Whately.
Thank you, Mr. Deputy Speaker. As we head towards a winter where care homes may have to battle with COVID and flu, the question we should ask ourselves is, what more can we do? Over the last year and a half, COVID-19 has sadly taken many thousands of lives, particularly the lives of older people and the lives of those with underlying health conditions, particularly the lives of those who need the kind of care you receive in a care home. Mr. Deputy Speaker, there have been more than 40,000 deaths among care home residents. They were mothers and fathers, grands and granddads, brothers and sisters, sons and daughters. And sadly, we've lost some of our dedicated care workers too. Despite all the efforts that have been made by care homes and their staff, local authorities and by us in government to keep COVID out, despite PPE, despite testing, despite isolation. Throughout the second wave, care homes used 26 million tests and 1.4...
Order. Sir Christopher Chope.
Mr. Deputy Speaker, I raised a point of order earlier about the lack of an impact assessment before the House this afternoon, despite it having been referred to on the 22nd of June as having been made available. And I was informed during the course of that point of order that pressure was going to be put upon the government to explain why there was no impact assessment, and it is therefore a source of great disappointment that the Minister hasn't started off her speech with such an apology and explanation.
I'd like to thank Sir Christopher Chope for that point of order. Clearly the Minister is on her feet and she looks as if she may indicate that she may give a response to that point of order herself, as it's not a point for the Chair. Minister.
Thank you very much, Mr. Deputy Speaker. I was indeed intending to come to make that point. I was commencing my speech to give some further context. But what I can do to respond to the specific point by the Honourable Gentleman is to say this, that the impact assessment is being worked on. And I will be clear with honourable members that one of the challenges here is that there is significant uncertainty about the level of behavioural change that we may see in weeks ahead from this and from other measures. For instance, the requirement for vaccination to travel to some countries which we anticipate will lead to further vaccination uptake. Now, I know that some honourable members, if he will let me, I am covering this exact point. I know that some honourable members may wish to delay this debate because they wish to review...
Point of order. Point of order.
Point of order, William Wragg.
Mr. Deputy Speaker, it states in the explanatory note that a full impact assessment has been prepared. If it has been prepared, it can't currently be in preparation, so where is it?
Again, that's not a point of order for me, but it could have been an intervention upon the Minister. So let's allow the Minister to give the full response to the points that have been made, and perhaps you can include that one from William Wragg. Minister.
Thank you, Mr. Deputy Speaker. As I said, the impact assessment is being worked on. That is the current situation. And what I was explaining was one of the challenges in coming to an impact assessment that I feel we can share with colleagues to inform them accurately, and I know and I really hear that honourable members want to have the full set of information for this debate. What I will say here is that we face a dilemma, that the clock is ticking. Each day, one moment, each day we are moving closer to winter. I'm going to come on to it in the detail of my speech. But one important feature of this proposed legislation is that it gives staff a grace period in which to get vaccinated. The longer we take on this, the more risk there is to having that grace period. What I will say, though, on this specific point, so one thing I can share, which is evidence that we have on how this kind of policy is working in practice, is from a large care home provider that is already implementing a requirement for their staff to be vaccinated has seen the vast majority of staff get vaccinated, with less than 1% of their workforce choosing not to be vaccinated. What I will say is one more thing, is that we have committed, and my honourable friend, the Vaccines Minister, committed this earlier to the Scrutiny Committee, that we will publish an impact statement setting out the evidence we have in advance of the Lord's debate. If my honourable friends would let me make a little more progress, I will absolutely take more interventions, but I'm conscious of wanting to set out the context and the thinking behind this piece of legislation, and I may well indeed answer many of my honourable friends' questions as I proceed. So if you would just let me make a little progress, I assure my right honourable friend I will take interventions. As I was saying, throughout the second wave, care homes used 26 million tests and 1.2 billion items of PPE, yet still we saw outbreaks in many care homes during the winter, and 14,000 deaths from COVID among care home residents. But, Mr. Deputy Speaker, there is one thing now making a huge and crucial difference, a major advance which is unequivocally saving the lives of care home residents and staff from this cruel and pernicious virus, and that is vaccination. I've spoken to residents who were in tears as they were vaccinated, tears of joy and relief that they at last had their own defence against this virus. So far, the vaccine rollout to residents and staff in care homes has been a big success story. JCVI made residents and staff in older age care homes the highest priority as soon as vaccines were available, and the NHS hit their target of offering the first dose to all care homes by the end of January. A fantastic effort.
Will my honourable friend give way?
In one moment. Vaccination teams have made multiple visits to care homes since then, and as a result, 96% of those living in older age care homes have had their first dose, 93% have had their second dose, 92% of residents living in working age care homes have had their first dose, 87% their second dose. Take-up amongst staff has also been strong. 86% of staff in older age care homes have had their first dose and 75% their second dose. 83% of staff in working age care homes received their first dose and 72% their second dose. And our vaccination teams have gone to great lengths to support and encourage those who've been worried about the vaccination, along with care home managers and care colleagues. And I'm sure my honourable members will join me in thanking everyone in the NHS, local authorities and care homes who've worked so hard together to achieve these levels of vaccination. I will take a notion from my right honourable friend for the Forest of Dean and then my...
I'm grateful. I'm grateful to the Minister. Can I just say to the Minister, coming back to this point about the impact assessment, in the documents prepared for the House, it says a full impact assessment has been prepared. Now, Ministers need to give accurate information to the House. If that is not correct, and it's misleading, it should be corrected immediately. And it's not good enough to say something's going to be coming along afterwards. We're going to be asked to vote on this today. There is no urgency here. These regulations do not come into force for 16 weeks until November. So it is perfectly reasonable for them to be taken away, for that impact assessment which has been prepared to be published. If there's uncertainty, share the uncertainty with the House. It isn't good enough to expect us to vote on something that is difficult and controversial and complicated and not share the information with the House that the Minister has at her disposal. It is an abuse. It's not good enough.
Well, during the course of this speech, I will share as much information as I can with my right honourable friend on the rationale behind this. But what I will say to him on the point about the timing of it and why he says, well, it could be done later. The problem is that if you do it later, are you then suggesting that care home staff who have not yet been vaccinated, then it's too late? The point is to give care home staff the time between this being legislated upon and it becoming implemented in time for the winter when we know that there is this greater risk of the combination of COVID and flu, to have the time to get vaccinated, knowing, for instance, that we're generally seeing an 8-week period between doses. I will take an note of my right on the phone.
She will appreciate that the provisions before us extend well beyond care home staff. But with respect to those staff, the 1% that she spoke of, in the absence of the impact assessment, if their failure to be vaccinated results in dismissal, who will be responsible for the compensation?
Well, my right friend asks an important question about the process of how this would work in practice, although I think he's sort of presuming that there is a question of compensation here. So what I'm expecting to see is that care home managers will be able to, care homes will be able to follow a process. And so long as they follow a fair process, there should be no need for compensation, as he suggests. We will set out guidance on this, but the point is that there is a fair process in which, for instance, a care home can discuss vaccination with their staff member. They can indeed look to whether there might be an alternative role that individual could do if they really don't want to be vaccinated, although I'm realistic that there are not that many roles for staff in care homes that don't involve being within the care home. And after that, they must, if there still is a situation where the staff member does not wish to be vaccinated, then follow a notice period and make sure they follow a fair process. I know that the honourable member opposite wished to intervene.
I want to thank you, Deputy Speaker. I want to help the Minister. We're having to make a decision in the House this evening on the balance of risk, and therefore we haven't been given the data because the impact assessment hasn't come forward. So the Minister is in effect asking us to make a decision on information which we have not yet been able to see. And therefore, wouldn't it be more sensible to withdraw this statutory instrument, ensure that we have got the right data in front of us, and then we can make an informed choice?
Well, I mean, what I would say to her is we live in an uncertain world, but we know that COVID is a killer. We know that COVID is a killer for people living in care homes. And we know that the winter ahead of us is going to be challenging, both because of COVID ongoing in circulation and flu. And the question we should put to ourselves today is, what are the steps that we can take to make people safer in the months ahead? And what I say, this time last year, last summer, infection rates were low. But we didn't sit back and say, well, in that case, it's going to be okay for the winter. We in government, working with local authorities, working with care homes, made preparations for the winter ahead. And I say, thank goodness we did make those preparations, because although there were sadly many deaths, without having put in place the PPE distribution system we had, without the level of regular testing that was going on care homes through the winter, without the support with infection prevention and control, I fear that last winter would have been much, much worse. And that is why, looking ahead to the winter ahead, we know that it's going to be another challenging one, and we must prepare for it. As the Prime Minister, I will just make some progress. As the Prime Minister and our Chief Medical Officer have said, even when we are no longer in a pandemic, the virus will remain in some shape or form, and we will have to learn to live with it. It will continue to circulate, potentially evolving new variants, and there is a serious risk of resurgence of flu and other seasonal infections. A combination of COVID and flu may be unpleasant for many of us, but it will be life-threatening for those most vulnerable. So we must ask ourselves, Mr. Deputy Speaker, what more can we do? What more can we do to protect those who will be most vulnerable?
Since the debate, Mr. Speaker, there was a discrepancy between the explanatory memorandum and the explanatory note at the back of the instrument. The note states that a full impact assessment of the costs and benefits of this instrument is available from the Department of Health, giving its address, and indeed the website upon which it is supposedly published. So is the explanatory note in the body of the instrument correct or not, sir?
There again, this is not a matter for the Chair, but it is certainly a point for the Minister to address. And I think it would be helpful if the Minister could directly address this particular issue that many members are now raising.
Thank you, Mr Deputy Speaker. There's not a great deal more I can say on this point. As I've said, the impact assessment is being worked upon and will be shared with colleagues as soon as we can. That is what I can say on this particular point.
Point of order, Mr. Speaker.
Point of order, Sir Christopher Chope.
Yes, yesterday I asked the House of Commons Library to inquire of the department where this impact assessment was. And the department informed the House of Commons Library that they were about to present the impact assessment. They did not say the impact assessment was still under preparation. The implication was that it was ready to be given to the House, and it was just a matter of time, and they said they'd do it as soon as possible.
There again, I can only say what I've heard during this particular debate, and apparently the impact assessment is simply not available. This clearly is not the best situation. We can see exactly what it is, but it is what it is. Minister.
Thank you, Mr Deputy Speaker. SAGE recommends that 80% of staff and 90% of residents should be vaccinated in any care home at a minimum, to provide protection against outbreaks of COVID. While the majority of care home workers have now been vaccinated, our most recent data has told us that only 65% of older age care homes in England were meeting this safe minimal level. And this figure fell to 44% in London. And that is why this instrument is being brought forward today. This instrument means that by November, subject to parliamentary approval and a subsequent 16-week grace period, anyone entering a CQC-registered care home in England must be vaccinated unless an exemption applies. This will apply to all workers employed by the care home, those employed by an agency and volunteers in the care home. Those entering care homes to undertake other work, for example, healthcare workers, tradespeople, hairdressers and CQC inspectors, will all have to follow the new regulations. The introduction of this policy has not been taken lightly. We consulted extensively, including with a wide range of valued stakeholders, and used their feedback to inform this legislation. We recognise some people feel workers should have freedom of choice about vaccination, while others do this as a duty of care to protect people most at risk. And I know from speaking directly to people who receive care, and also those who have relatives living in care homes, that while they might not be sure about requiring all care workers to be vaccinated, they are sure that they individually want to be cared for by someone who is fully vaccinated. And many people have little choice about who cares for them. I'm happy to give way to...
But she mentioned on feedback, and in the explanatory memorandum, it says that a majority, i.e. 57% of respondents, did not support the proposal. How, therefore, does the feedback show their support for this proposal?
We have reviewed the huge number of responses we had to the consultation, and indeed, not everybody responding, as he said, 57% was not in support of it. Although one thing that was interesting was that there was a fairly even picture between care homes for those who were in support about it and those who were concerned. And one thing that we are already seeing is that some care homes are bringing in this policy themselves. However, well, I may preempt his point perhaps. I know that honourable friends have said to me, well, as some care homes are doing that, why does government need to do it? The problem is, we then risk a situation where if you are fortunate enough to be living in a care home where they have required it for all their workers, then you are highly protected against a vaccine. But if you are less fortunate or in a care home where far fewer staff are vaccinated, you are unfortunately at much greater risk, and that is not a situation, that inequality, which I think any of us should be comfortable with. I'll give way to my...
Sorry, giving way, Minister, tonight. This will set the trend, will set the marker, will set the pointer for direction for not just for this place, if the vote's taken, but indeed for the whole of the United Kingdom, and in particular, can I mention, for Northern Ireland. So can I ask the Minister, before we make this decision, has the Minister had any opportunity to talk to the regional devolved Minister, Robin Swan, in this particular instance, to gauge his opinion and where he feels this legislation would affect us? Thank you.
I thank the honourable member, and he's right, and I know that other parts of the United Kingdom are watching what we are doing here in England, and there are regular conversations between the Department of Health and Social Care in England and the other administrations. Also relevant to this is the situation internationally, where there are other countries which have either done this or looking very hard at this. In fact, France has just announced that they are going to require vaccination for health and social care workers, and indeed on a faster timeline than the one that we are proposing here. Mr. Deputy Speaker, never again do we want to be back in a situation where we have COVID outbreaks across hundreds of care homes, with those living and working in them losing their lives to this virus. Vaccination is a safe and effective way of preventing the spread of COVID. The majority of care home workers have already taken up the vaccine, and it's essential that all care home workers who can have the vaccine do so in order to protect those in their care. The original scope of the consultation proposed applying this to only those care homes who look after older people, but following the consultation, it became clear that there was a compelling case to extend the obligation to all care homes providing care to the most vulnerable, for example, young adults with learning disabilities. And there was also significant support for broadening the scope of the policy to include all those coming into contact with residents, and support to include all those entering care home residents in any capacity. We listened to this. I will just proceed, and I may indeed answer my honourable question as I go, but we listened to this and made the decision to apply the policy to all people working inside care homes unless they have a medical exemption or are not eligible for vaccination, for instance under 18s. There are further exemptions, including people providing emergency assistance or undertaking urgent maintenance work, and family or friends visiting, and guidance will be published giving more detail about the exemptions, which will reflect the Green Book on immunisation and clinical advice from the JCVI. I will give way to my right hand.
Grateful to the Minister. Can she explain why the statutory instrument doesn't differentiate between those workers who actually come into contact with residents and those that don't?
Minister. My right honourable friend answers an absolutely reasonable question, and indeed we consulted on exactly this point. There are two reasons which are relevant to why there's the breadth of this to cover not only, for instance, care workers, but others coming into the care home. As I've mentioned, that includes, for instance, hairdressers, other health professionals, and also, for instance, tradespeople. So one thing is that when you have somebody coming into the care home, including a tradesperson, they may be spending significant time in the care home. They may be moving around within it. They may be moving from room to room. So they may actually be a significant infection risk to the care home. They may also move between one care home and another, if they are particularly sort of specialised and serve multiple care homes. So we know there is a risk when individuals are moving between care homes. So there's a clinical case for it. Also, we heard from providers responding to the consultation that they wanted a consistent approach for people who are entering the care home to do a job of work, and that would make it more straightforward for them to implement. Madam, I will give way to my honourable friend.
I'm grateful for the Minister for giving way. I wonder if on that balance of what she's just said, making sure there's equity, where she believes the duty of care falls given the legislation that's being put in place.
Well, I mean, I think he makes a really important point. I mean, I know I felt it and the government has felt this through the pandemic, that our responsibility to those who are living in care homes to protect them as best they can from this pandemic, from COVID. And this is something that we can do to try and extend the protection of being cared for by people who are doubly vaccinated to residents in care homes, knowing as we do now with the increasing evidence that being vaccinated not only protects the individual, but also reduces the risk of transmission. Madam Deputy Speaker, I tend to sum up, as I know that there are other colleagues who wish to make speeches, but I want to put on record my sincere thanks to care workers across the country, not just for their work throughout the pandemic, but for all they bring to our health and care services. People working in care homes have played an incredibly important role caring for those most at risk from this terrible virus. The vaccine is working, with over 14,000 lives saved so far. It's only right that we take every possible step to protect those most at risk. As I said at the outset of the speech, we must all ask ourselves, what more can we do to protect care home residents? And this, Madam Deputy Speaker, is what we can do.
Question is motion number 6 as on the order paper. Point of order, Mark Jenkinson.
Madam Deputy Speaker, I seek your advice on whether figures that were just used by the Minister that were more than a month out of date for vaccination figures might have inadvertently misled the House. Her own earlier figures on vaccination status of care home staff and residents suggested that it simply isn't possible for the figures to have reached both SAGE thresholds to be as low as the House was informed.
Well, I thank the honourable gentleman for that point of order. I obviously cannot comment on figures the Minister may or may not have used. I'm sure the Minister will have heard what the honourable gentleman says, and if there's anything that needs correcting, would do so in her summing up. Right. The motion is number 6 as on the order paper. Shadow Health Minister Rosena Allin-Khan.
Thank you very much, Madam Deputy Speaker. Since the start of the pandemic, our lives have all been so deeply affected. For our key workers, they have experienced more than their fair share of grief, strife and sacrifice. Our care staff have truly been the best of us during the last 16 months, nursing our loved ones at the end of their lives, being the person who holds our relatives when they are scared and confused, and facilitating greetings through windows, fences and across roads. They have been the family to our vulnerable relatives over the last year, and for that, I'll be forever grateful. And I don't think we'll ever be able to repay that debt. These aren't the words of a politician or even a doctor. They're the words of a daughter who's had to say goodbye to her father during the pandemic. And I'm eternally grateful for the care that my father received that went above and beyond what I could have expected. Carers who showed my family and I what humanity truly was. Changing their shifts to be with him, being on the end of the phone whenever we needed them, and facilitating whatever they could in order for us to be with him in his last moments. And I can never repay my father's carers for the humanity that they showed him as his condition worsened, while my family couldn't be by his bedside. Carers were scared, and many still are. The idea of passing a deadly virus onto the people in their care tormented them. And that is why we're here today. The idea that care workers do not think about the day-to-day safety of the people they care about is an insult. From my own experience, I know that their residents are of utmost importance. So often poorly paid, they put in the gruelling work because they truly care. To argue that they don't neglects their fears. We want everyone working in a care home to take up the vaccine. The vaccine is safe and effective, but we aren't inclined to support these proposals or the case for compulsory vaccination. There are serious warnings from the care sector that the government's plan could lead to staff shortages in already understaffed care homes. This would have disastrous consequences on the quality of care. And it's vital that we examine the current reality of life on the front line in care settings. In fact, Unison surveyed their members during the pandemic who shared that they were feeling more anxious and depressed than before, owing to the fear of passing the virus on to their relatives and those under their care. Many felt that their management was not equipped to support their needs, and resoundingly the care workers just wanted people to listen. listen to their experiences and the challenges they were experiencing without, and I quote, fear of being singled out as a troublemaker. Let's listen to our care workers today. Yes, I'll give way.
I'm really grateful to the speech that my honourable friend is making, and obviously pass on my condolences to her. But does she not agree with me, after all that our care workers have been through, that what they need at this time is a supported conversation about how they can progress with their own vaccination or not, but also just to have the right people in that place giving them that supported conversation?
My honourable member, it's almost my honourable friend. It's almost as though she has read the rest of my speech. I could not agree with her more. We have to listen to our care workers today, to the young pregnant carers worried about their next paycheck. Will these proposals make them more secure? To all those carers from communities who have lost trust in authorities, will the threat of them losing their jobs instill more trust? And to all of those carers that have loved and cared for their residents but have concerns about the vaccine and haven't had anyone answer their questions, are they being told that their dedication is suddenly irrelevant? To understand why there may be hesitancy amongst care home workers to take up the vaccine, it is important to understand the health inequalities that much of the workforce face. Madam Deputy Speaker, ethnic minorities are overrepresented in the adult social care workforce, with 21% of all care staff coming from a minority ethnic background. Negative experiences of a culturally insensitive health service, the higher rates of death from COVID for people from Black and South Asian communities, and a lack of representation of minority groups in vaccine trials and wider health research all serve to build distrust in the health system. These are some of the communities that have been hit the hardest during the pandemic. The disproportionate use of coercive and restrictive practices on minority communities also erode important trust in the system. Black people are 4 times more likely to be detained under the Mental Health Act than white people, despite making up a much smaller percentage of the overall population. With trust so low, it creates hesitancy. But this hesitancy can be overcome through effective communication and an understanding of the issues which have created it. Further coercion and punishment through the threat of being dismissed from employment only reinforces the reasons for hesitancy in the first place. Yes.
I know what she's saying, and it was my first instinct months and months ago, exactly the point she's just made about persuasion. But more than 7 months on, it hasn't happened now. I'm tempted to ask, if not now, when, to coin a phrase. What is her response to that?
I thank the honourable member for his intervention. The response is that the government haven't gone far enough to have these conversations. That is why there has not been the real effort made to engage with the communities that have been hit the hardest and for whom vaccine hesitancy is at its highest. With trust so low, it creates this hesitancy that I've just spoken of, and this hesitancy can be overcome through effective communication that hasn't yet happened under this government's watch. It will disproportionately, I'm going to make progress, thank you. It will disproportionately punish groups whose needs are already rarely reflected in mainstream health services or the labour market. Respectfully listening to concerns and offering practical support would not only tackle vaccine hesitancy, it would also help rebuild trust in health services, which in turn could eventually lead to reduced health inequalities for all minority groups. Let's be clear. Vaccine hesitancy is entirely different to being an anti-vaxxer. Vaccine hesitancy is a challenge for the government to tackle. It's harder work. There is no quick fix. The government is trying to make an incredibly complex issue into a black and white one, and this does nothing to pay respect to the sacrifices that care workers have made since the start of the pandemic. And more must be done to encourage uptake of the vaccine. I'm going to make progress, please. The UK government should learn from the fantastic work of the Labour-led Welsh Government, which is running the fastest vaccine programme in the world and vaccinated a far greater proportion of its staff compared to England. Yesterday's figures showed that almost 95% of care home residents and 88% of care home staff are double vaccinated. Wales has rejected compulsory vaccinations and instead chosen to work closely with the care sector to drive take-up, as well as valuing the workforce with a proper pay rise. It is that sort of leadership that is needed here. A failure of leadership here will place the care sector in an even more precarious situation than it currently is, with even fewer staff than at present. There are serious warnings from the care sector that the government's plan could lead to staff shortages in already understaffed care homes, and this would have disastrous consequences on the quality of care. Over 100,000 posts in the care sector are currently unfilled, with recruitment and retention already extremely difficult due to low wage levels for difficult and demanding jobs. Not only would this have a disastrous impact on those relying on care, but the stress and trauma placed on their relatives will affect so many across the country. We already have a social care crisis. Let's not deepen it. These proposals are at odds with the government's decision to throw caution to the wind by making social distancing and mask wearing optional and up for individuals to decide. It makes no sense. Surely forcing workers to receive a vaccine is at odds with the individualism they seek to promote at every opportunity. It seems odd then that care workers are being singled out. Why is there a different rule for them? If the government, hoping that the public will simply forget about their failure to protect care homes over the past year, is that what is going on here? To force carers to choose between losing their job or taking a vaccine that they're afraid of is inhumane. These are people who often work for less than the minimum wage. They are incredibly vulnerable people and their voices must be heard. Many of these people have lost multiple family members during this pandemic. They're being asked to put their faith in a vaccine they are afraid of. The government needs to be doing more to tackle misinformation, promote the positive benefits of taking up the vaccine, and support care home staff to do so. They haven't been doing enough to support care workers who have done so much during this crisis. They should be focused on driving up standards and retention of staff by treating care workers as the professionals they are, with improved pay, terms, conditions and training. We have a moral imperative not to force people to take a vaccine they're afraid of. So I urge the government to listen to our care workforce. Surely they deserve at least that after the last year.
Now, this debate finishes at 7:19. Sorry, I need to bring the Minister in at the end. What that means is that if colleagues spoke between 4 and 5 minutes, everybody would get in. If colleagues don't speak between 4 and 5 minutes, they won't get in. Sir Christopher Chope.
Madam Deputy Speaker, it's a pleasure to follow the honourable member for Tooting, and I'm delighted that the official opposition share my view of the view of many of my colleagues that these are bad regulations and that they should be opposed this evening. Both the Welsh and Scottish governments, as I understand it, are against this type of regulation, and so when the Minister told us that other administrations are watching, I think actually this administration should be watching what the other administrations are doing and following their lead. I must say that I think this is probably the most depressing performance I've had listened to in this House from a minister. She showed a cavalier disregard for the conventions and courtesies of this House, and she's also admitted to completely breaching the rules that the government has under its better regulation framework, which is designed to try and inform decision making for regulations which affect businesses and individuals in this country. When criticised, the response, I think, Madam Deputy Speaker, is best described as dumb insolence, and that's just not good enough. And I think that one of the questions which I would have liked to have put in an intervention was why is the government, what is the government's rationale for not requiring care home residents to be vaccinated. What is the rationale for that? These regulations were laid on the 22nd of June. There was an accompanying explanatory memorandum which expressly referenced a full impact assessment of the costs and benefits of this instrument is available from the Department of Health and Social Care and is published alongside this instrument and its explanatory memorandum. The Minister hasn't explained what's happened to it, whether it ever existed, whether it had information which she found embarrassing and therefore it's been suppressed. But, Madam Deputy Speaker, an impact assessment is not an optional extra. As the Secondary Legislation Scrutiny Committee has made clear in its report of the 6th of July, an impact assessment is a fundamental tool for those who wish to scrutinise legislation before nodding it through. And indeed, an impact assessment should be cleared by the Minister before the proposals are brought forward. And the government's better regulation framework principles set out in March 2020 say this: where government intervention requires a legislative policy change to be made, departments are expected to analyse and assess the impact of the change on the different groups affected, which should generally take the form of an impact assessment. That hasn't happened. Why hasn't it happened? I put down some parliamentary questions about this because I feared that we weren't going to get the impact assessment, and those questions have received holding answers instead of substantive answers. One of them was, what estimate has he made of the number of employees in England who will face dismissal from their employment as a result of these regulations, and whether those staff will be eligible for compensation? There wasn't an answer to that, and there hasn't been so far today. What estimate has been made of the number of staff employed in care homes in England and Wales who have not been vaccinated against COVID-19 for A, clinical reasons, B, reasons of personal choice, including religion, belief and conscience? Again, no answers, even to parliamentary questions. How can we hold the government to account if they won't even answer our questions? My constituents are absolutely livid about what's being proposed, and I won't quote extensively from a letter I have from Mr Davis from Ferndown, but he says it's completely wrong and unethical and it makes no sense. An NHS consultant in Christchurch says mandatory vaccination would be a crossing the Rubicon on medical choice, medical confidentiality and bodily autonomy, the vital elements of the right to privacy. And the Christchurch care home manager to whom I've spoken has said that this whole proposal undermines the need for parity of esteem between care workers and NHS workers. You may have seen, Madam Deputy Speaker, the article in the British Medical Journal on the 8th of July, which says that vaccination is not a panacea for safety, that it may reduce the risk of transmissions and so on. But why are we saying that people who have had previous infection and got immunity from that, why are they not exempt from these regulations? And I think this is, as is stated in that report, an unnecessary, a disproportionate and misguided proposal. So I hope that the House will, along with what's happened in Scotland and Wales, reject these regulations and put the Minister out of her misery.
We now go to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. I don't usually speak in the debates about statutory instruments on COVID regulations as they only apply in England, but I feel I have to make a couple of points on the plan to make COVID vaccination mandatory for all care home staff, the first mandatory vaccination legislation in the UK for well over a century. As chair of the all-party group on vaccinations for all, I totally support vaccination. And I want to draw attention to our recent report published in May on how to improve the uptake of all vaccines. Virtually all our expert contributors highlighted the dangers of making vaccination legally mandatory, as while it may force uptake among some, it tends to increase distrust and suspicion of vaccines and drive those who are hesitant to become vaccine refusers. In Scotland, virtually 100% of care home staff are fully vaccinated with both doses without the use of mandation. And this has been achieved through three key policy approaches. As part of developing caring as a profession, care home staff in Scotland are now registered, which means we have information on who it is we're trying to reach. When the Scottish Government became aware that care home staff were being deliberately targeted with disinformation on COVID vaccines, they arranged expert webinars for staff with our Chief Medical Officers and NHS Director. Thirdly, as soon as the Pfizer vaccine became available in December, care home staff were vaccinated at the same visit as residents. Not only did this improve convenience, but created a strong sense of solidarity between colleagues and with the vulnerable people they care for. The Scottish Government faced considerable criticism at the start of the year for spending so much time and effort on care homes, rather than pushing ahead with mass vaccination centres, but it has paid off. In England, we hear 86% of care home staff have received a first dose and 75% are fully vaccinated, although I understand this hides a wide variation in uptake. While repeat visits have now been provided to care homes in England, this was not national policy at the start of the programme, when many providers reported difficulty in accessing vaccine appointments for their staff. The UK Government has never taken forward the principle of care staff registration and professionalisation in the care sector. And as has already been highlighted, staff in England are not even paid the real living wage. Care home staff have faced a very difficult time over the last 18 months, and we all owe them a great debt of thanks. I still think locally targeted support, information and persuasion would be more successful in convincing care home staff than heavy-handed legislation which actually threatens their jobs. We all agree about the need to get the highest rate of vaccination possible to protect care home residents. The difference is how to get there. Our APPG report makes very clear that the most important approach when dealing with communities with hesitancy is not to make assumptions about the cause, but to listen to them and then act on what they are seeking. Apart from my concerns about mandating vaccination in principle, I would call on the Minister to clarify that this legislation applies to England only. The Scottish Government do not accept the principle of making vaccines mandatory, nor do they see the need for such an approach after the fantastic uptake of our care home staff.
Thank you very much. Mark Harper.
Mr Deputy Speaker, and I don't often say this, but it was actually a great pleasure to follow the honourable lady who speaks for her party, and in this case from the APPG on vaccination, and I agreed with not necessarily about the Scottish Government, but almost every word she said about, I think, the right way of persuading care home workers to get vaccinated. I should say first, Mr Deputy Speaker, before I touch on the specific proposals in front of us, that I do agree with the Minister when she says it's very important that we protect those who live in a care home setting. We've all seen the damage over the last year from COVID, and it's fantastic that we now are able to vaccinate those residents, because we know COVID is a disease that is focused on wreaking most havoc on those who are older and those with health conditions. And it's fantastic, as the Minister herself said, that 96% of residents of care homes have had a first dose and 93% a second dose, which means they've got very substantial protection against both serious disease, hospitalisation and, tragically, death. And that's fantastic. And I think everyone in the House, and I think I can speak for everyone, wants to make sure we protect people in care homes. This is a debate about how we best do so. So let me just take the arguments that the Minister set out. First of all, I agree with what the Honourable Lady said in terms of persuasion. I've certainly talked to my local health professionals, and they very much advocate listening to staff who are hesitant, understanding the reasons, and then trying to address those reasons. And I know the Minister has said that a significant number of healthcare staff have been vaccinated, but it's not consistent across the country. In some places, it'll be 100%. In other places, it'll be much lower. And it seems to me what you therefore need to do is focus on those areas where it's much lower and understand what the barriers are rather than telling people, insisting that they've got to do something they clearly have some concerns about. It may be because they're from a particular ethnic minority and we know there's a differential vaccine take-up there. It may be that they're younger, female of childbearing age, and they are concerned, I think erroneously, but concerned about things they read about fertility. And you need to deal with those. You can't threaten somebody who's young and worried about fertility and insist that they take a vaccine they're worried about without dealing with those concerns. So I think we all agree about that. This is about how best to do it.
Would you allow
and I, of course.
I'm most grateful to my right honourable friend. Would you agree with me that in some cases, seeming to threaten people will only worsen the problems of trust in authority from which people might already be suffering, causing them to be hesitant in the first place?
Well, I agree with my honourable friend, and I think that's why I think these proposals are mistaken. And let me just step briefly through the proposals in front of us. First of all, I completely agree with what my honourable friend said about the impact assessment. Now, I've been a minister, I've been through impact assessments, prepared them, signed them off and presented them to the House, and I'm afraid it's not good enough for something that's got very significant impact on thousands, hundreds of thousands of people, in fact, many thousands of businesses, and is a significant step. This is the first time we would have mandated in law effectively compulsory vaccinations. It's frankly offensive that it's being debated in a 90-minute statutory instrument debate in the House, which I have to say, Mr Deputy Speaker, because the name of the regulations is not doesn't leap out at you what it is. I think many colleagues were unaware of the fact we were being asked to vote on this today until it was drawn to their attention. So that's the first point. The second point is that if that information is available, even if it is imperfect, and I accept that it'll be imperfect and there will be things that we can't be certain about, it's the Minister's duty, if she has that information, which one of these documents says she does, one of them says she doesn't, but if she has it, it's her duty to put what she has in front of the House, sign it off, she's responsible for, and allow us to see it before we're asked to vote on it. And I'm afraid it is an abuse of the House to ask us to do this. Now, if it was genuinely an emergency, it might be acceptable. But as I've already said, these regulations, if they're passed, do not come into force for 16 weeks. That's November. There's ample time to complete the impact assessment, to bring this back before the House, even if it was in September. You could then have a tighter deadline and still deliver the legislation before it's currently scheduled to become law. I think that would be preferable. Now, it's worth saying, Mr Deputy Speaker, I could have been persuaded, although I have reservations, I could have been persuaded to support mandatory vaccination for care home staff if a good case had been made about the risk reduction to residents. Now, I didn't hear, actually, the case being made about the risk reduction to residents. It's not set out in any of the documents in front of us, and the Minister didn't set it out in her remarks. But I'm open to that, and I remain open to that. And that's why I would urge her to bring back further proposals later. But in terms of what's in front of us, that isn't what these are at all. These are incredibly broad. They apply to everybody who enters the premises of a care home. Even if they never see a resident, are there for moments, the care home will be prohibited by law from allowing them to enter, and we'll have to ask them intrusive questions about their health status, including perhaps what health conditions they've got that mean they don't have to take a vaccination, which means that care home's then got to ask the employer, and it means those businesses that want to transact with care homes have then got to ask those intrusive questions of their employees. The scope is massive. And it's particularly troubling, given what the government said yesterday in the House about domestic vaccine passports. Many of us are concerned that this is the thin end of a wedge to start insisting that employers ask their staff intrusive questions about their health conditions when there is no good reason for doing so. And that's why we're concerned. Of course I'll give way.
I'm sure my right honourable friend is making a fantastic argument, as he always does in this place. I've interweaved where these new regulations would fit into the Health and Social Care Act 2018, Regulates Activities Regs 2014, and we are asking care homes to be the policemen of delivery people and plumbers and window cleaners with a £4,000 fixed penalty possible fine. I don't know if he was aware of the extent of the fine that backs up these regulations.
I'm grateful that my honourable friend has brought that information to the attention of the House. Now, let me just bring my remarks to a conclusion, because Mr Deputy Speaker wants to make sure we get everybody in. The final point I would say is coming back to the consultation that took place. It's very clear from these from the information in here, most of the people responding did not support these proposals. They were very concerned about them. Certainly care homes I've heard from and those involved in the sector are very concerned about them. They don't command wide support. So I would say to the Minister, I would listen to the concerns that are being expressed. I would take these proposals away, come back with some well thought through proposals to secure the support of the House. If she presses them to a vote today, I regret, Mr Deputy Speaker, I will be forced to vote against them.
Guarantee everybody gets in. 5-minute limit. Munira Wilson.
Thank you very much, Mr Deputy Speaker, and it's a pleasure to follow the Right Honourable Member for the Forest of Dean. I pretty much agree with everything he had to say. I want to preface my remarks on these regulations by making it abundantly clear that I and my Liberal Democrat colleagues unequivocally and strongly support vaccination and would urge everybody who is eligible to be vaccinated. We know they're safe and effective and save lives. And for those on the front line, whether working in social care or indeed working in the NHS, of course vaccination is critical. And if I had a loved one in a care home, of course I would want maximum protection for them and therefore all staff to be vaccinated. The question we as legislators have to grapple with is whether coercion is the answer and what might be the unintended consequences of mandating vaccination for some of the lowest paid and most undervalued workers in our society and a sector that is on its knees. Now, as we've heard, with chronic staff shortages facing the sector, making vaccines mandatory has a real potential to exacerbate these acute shortages. I believe the government must do much more to convince and persuade care workers to get vaccinated. As many experts have said, and as we've heard already, coercion is usually ineffective or worse, counterproductive, and risks eroding trust in the sector. Indeed, the care sector has a long history of being overlooked and underfunded. 1.6 million social care workers earn less than the living wage. A quarter of the workforce are on 0 hours contracts, and there is a lack of progression, any progression or career prospects. For those who are vaccine hesitant, there is a real concern that they may simply leave the profession rather than get vaccinated, particularly as we know that there are serious shortages in other sectors, such as hospitality, who are offering more competitive pay. Now, with 1.5 million older people not currently getting the care they need, already overstretched staff will become even thinner on the ground. Care providers, many of whom are already in a fragile state as a result of the pandemic, could find themselves having to deal with the costs of tribunals and legal challenges as a result of individuals losing their jobs. What support and resource is being provided to the sector to implement this policy? Secondly, coercion is not an effective way to overcome hesitancy. Compulsory vaccination is a blunt tool for a complex issue, and research has highlighted that pressuring care workers can have damaging effects, leading to erosion of trust and worsening concerns about the vaccine and hardened stances on refusing vaccination. Indeed, digging into some of the detail, actually the rate of uptake may not be as bad in some places as it initially seems. And the data is somewhat encouraging in that there's actually a significant disparity between the percentage of staff who've taken their first jab and not their second. For instance, Wandsworth has the lowest uptake rate with 70% of staff having had their first jab, but only 53% having had their second. This could indicate that actually government and NHS initiatives are bearing fruit, so mandating vaccination could be premature. Alternatively, it may suggest there is a problem with trying to get care workers back to have their second jabs. All of this suggests a much more complex picture for which this blunt tool is not the answer. And we risk, as others have said, going down a slippery slope to chip away at people's rights and freedoms to make their own health choices. This decision sets a precedent and must not be taken lightly. And this leads me on to my final point. In part, we've arrived here at this situation precisely because the care sector has been overlooked for so long. It's long been a Cinderella service and a poor relation to the NHS.
And yet again, we see here that this legislation only applies to care home workers and not NHS staff, so it does feel very discriminatory to many in the care sector. So I come back to where I started. I want to protect the most vulnerable, but I fear these measures will do more harm than good. And we risk a mass exodus of staff in an already overburdened, overstretched and underfunded sector. In March last year, when my Liberal Democrat colleagues in the other place and I were asking searching questions of ministers about testing and PPE to protect care homes, there were no answers. The truth is, the tragedy we've seen unfold in our care homes throughout this pandemic has resulted in thousands of excess deaths is because that protective ring that ministers have talked about went in far too late. This legislation we're being asked to support is in reaction to government inaction and failure to protect care homes, and because it continues to drag its feet on reforming the sector properly. Coercion and an assault on fundamental rights and liberties should not be the response to this. We must encourage, empower and support people to make the right decision to get vaccinated. We must pay and value our heroic care staff properly rather than point the finger of blame at them.
Scrambled. Thank you, Mr Deputy Speaker, and I agree with much of what the Honourable Lady opposite has said. But I begin, as others have, with the impact assessment, or the lack of an impact assessment. And I hope the Minister, on reflection, will accept that it is simply wrong to bring these measures forward without giving the House that impact assessment in advance. She has got the opportunity still to do something about that by withdrawing these measures and coming back at a later date, and I hope she will consider that. This is a very serious innovation, Mr Deputy Speaker, a legal requirement being imposed for people to undertake a medical intervention which may be against their will is a remarkable change in our law. And as the Honourable Lady opposite said, it sets a very serious precedent. And a precedent, it has to be said, which the Minister, I thought slightly alarmingly, raised herself when she said as the winter approaches, COVID and flu will be a problem. As yet, we're not talking about compulsory vaccination for flu, but once we begin down that road, where does it end? The scope of this measure is unnecessary. As I raised in my intervention, insisting that people are vaccinated, even if they will have no contact whatsoever with residents of care homes, is entirely unreasonable. The application to a plumber who comes to fix a boiler, a trustee of a charity who may go to sit in an office but have no contact in any of the areas where residents would be. And it's inconsistent. Why does it apply only to care workers, not more widely in the healthcare sector? But I want, of course.
Thank you. I'm grateful to my honourable friend. Is it not the case, we heard from the Minister about the 99% vaccination uptake where an employer had mandated it themselves. Would it not be the case, as in the case that you set out with visitors, that it would be, if it was in departmental guidance, it would be incumbent upon the care home to take cognizance of it in the risk assessment?
Absolutely, I agree with my honourable friend, and the perfectly rational arrangements that could allow particular residents to insist on only a vaccinated carer being in attendance. But I want to focus in the brief time available to me, Deputy Speaker, on a very specific point, which is the importance of respecting religious freedom. Limetree House in Sale, in my constituency, is one of only 2 Christian Scientist care homes in the country. And the rights of Christian Scientists were protected by the party of the government opposite when the Care Standards Bill was introduced in 2000. The Minister then, Lord Hunt of King's Heath, was explicit in his assurance on the floor of the House of Lords. And I'll share that, if I may, briefly with the House, when he said, "Perhaps I may say right at the start that the government have no intention of preventing or discouraging people from being cared for in accordance with the principles and practices of the Church of Christ Scientist. The Care Standards Bill will not mean that Christian Science houses or their visiting nurse services will have to give medical treatment to their patients or do anything else which would go against their religious principles. The Department of Health will consult and work with the Church of Christ Scientists to ensure that regulation by the Commission is compatible with the Church's principles and practices. And that was in Hansard reference was column 741 on the 28th of March 2000. What we have here is a situation where Christian Scientists responded to the consultation in May. They have since then written to the Minister and indeed to the new Secretary of State, well obviously that was very recently, but have had no response. And clearly no provision has been made in the legislation that is before us to protect this important principle. So can I ask the Minister now, when she responds, to give an absolute assurance that the principle of religious freedom will be respected by this government as it was by previous governments? Will she either undertake to bring an amended statutory instrument to the House, or, if she won't do that, will she commit to including matters of conscience in the exemptions which are provided for in this measure? I'm talking here about 2 small care homes, a handful of residents, and a situation where both the residents and the carers might prefer not to have a medical intervention inflicted on them against their will. But a very big principle is at stake.
Well done. Just remind Dr. Evans that I will interrupt you at 7 o'clock briefly to put the deferred motion to the House in order that we can have live votes on this and the motion on terrorism as well. Dr. Luke Evans.
Thank you, Deputy Speaker, and I look forward to that time to get my breath back. I, like many in the House, balked at the prospect of mandatory mass certification or vaccination. I've made that clear privately and to my constituents who asked. I didn't think it was ethically or practically or even medically reasonable because they should always be proportionate in our response. However, I also made it clear that I believe there are specific carve-outs. Those are aimed at the most at risk, and indeed, when it comes to healthcare and public health, I think there is a prime example of the essence of who we're dealing with here, the elderly and the vulnerable. Because this argument boils down to rights v responsibilities of what or whom and to who. You see, there's a duty of care by the government and in turn the providers to both patients and their members of staff. And this House has to navigate the difficult part between limiting the risk to patients and residents with the spread of the virus while respecting the staff's rights and responsibilities. And over the next minute or two, with the break included, I'm going to go over a couple of principles that I think are at practice and some real-world challenges we face. Because according to the CQC, when it comes to talking about vaccinations, there are 3 particular pieces of legislation that are important. Health and Safety at Work Act 1974, Control of Substances, Hazards to Health, Regulations 1992, and of course the Health and Social Care Act 2008. Now we are obviously dealing with the latter, but the former 2 set a precedent of safe working environments dealing with dangerous substances to health, putting a square responsibility on the organisers and the providers to mitigate this for staff and users as best as possible. See, I don't expect it too long before we'll see a legal challenge where a resident dies from COVID and the finger's pointed squarely at the care home staff or the care home for not having vaccinated staff, given we know the vulnerability to the elderly. There is a duty of...
Just now interrupt very briefly. We must now take the motion relating to deferred divisions. Minister to move. The question is the motion relating to deferred divisions. As many of that please say aye. Don't you know? I think the ayes have it, the ayes have it. Dr. Luke Evans.
So there is a duty of care I return to, and that is a running theme, duty of care. Currently, there is no law to say vaccines are mandatory. So make no mistake, this is a departure from the legal precedent, but not nearly as big or as wide as the public or indeed this House may be led to believe, as in essence, practically this precedent already exists in the NHS with the likes of TB. See, if you're let's take the example of a medical student or dental student. When it comes to joining medical schools, you have to have TB check, HIV check, Hep C, and treatment to practice. While it's not a legal requirement, operationally, it means you can't do procedures, you can't do hospital placements, and in dental particularly, you can't progress. Why? A duty of care. I don't recall a huge outburst about such concerns when the Department of Health Clearance Guidelines 2007, which were revised in April 2014, entitled Health Clearance for Hep B, Hep C, HIV and TB, was widespread. Why? The reason when you enter into these professions, the overriding principle, hammered in time and time again, is there's a duty of care to patients. And there's a duty of care for the medical schools and providers for their students.
Would you allow me?
Of course.
I'm most grateful. My honourable friend, of course, he's an expert in some of these matters. But he's conceded that in the cases he's referred to, that's not a legal requirement, it's a matter of health and safety. Why is it that in this case he wishes to cross the Rubicon and mandate that you may not be in a care home, apart from the conditions, unless you're vaccinated? Why does he want to put it in law in these circumstances?
Well, my right honourable friend has preempted the rest of my speech, where I hopefully try to address some of that. Because it's about recognising the parity between professions. We heard the right honourable member on the other side of the House talk about the professional recognition we need for social care. And that's imperative, and we've covered this in the Health Select Committee. Our report is very, very clear that we need to draw that parity with professional standards. Because we've heard time and time again, they have gone above and beyond in their duty. And I'm a realist when it comes to this, and I want the government to draw to the attention the fact that there could be difficulties. It is going to put a problem on when there are 16 weeks consultation, and there could be an exacerbation of the workforce. I'd also urge the government to pick up on what other members have said and encourage people to take up vaccination in the first place. But fundamentally, and maybe this is where it comes down to for the honourable member who intervened, this comes down to a duty of care to the looked after. I asked the House, if this was your grandmother, your grandfather, your father, your mother being cared for, I'd want you, and I'd expect you to say, you want the best possible protections for the individual and institution where they're resting. And
Order. You really sorry. We do have to leave it there. 4 minutes each. Dr. Ben Spencer.
Thank you, Mr. Deputy Speaker. Controversially, perhaps, I think that much of this SI is uncontroversial. And the reason behind that is my experience in terms of being recruited to go through medical school. So as part of the recruitment process, it was made very clear to me I had to have Hep B testing, I had to be vaccinated for Hep B, and going through and getting involved in becoming a medical student, this would not happen if that was not the case. And I think that's fair enough. We expect of our health staff vaccination for a variety of conditions, not just hepatitis B, things like chickenpox, for people who haven't been exposed, things like rubella, because we know the impact that can have on the patients that we look after or the people we care for. And we know the huge impact COVID has on the most vulnerable in our society. Its lethality, its severity is linked to frailty, and I think one of the most frail groups are people who are living in care. And it's important that people are vaccinated so that they don't unintentionally, when they have asymptomatic COVID, give them COVID and pass it on. We know that rates of vaccination are not high enough to give that protection that's necessary to protect people in care homes. And I think on that basis, I think it's entirely reasonable and a sensible approach to bring forward measures in terms of saying that people have to be vaccinated to work in that setting. Now, that being said, of course, I realise that although that might be what I say a sort of reasonable approach, it's actually quite different to my personal experience as I've just described, because that was a pre-recruitment process I went through. What we're talking about now is a process for people who are currently in post, for people who've been working for quite some time, for people who've got quite a lot of years behind them, and that if they don't go through vaccination, then ultimately they'll be without a job. And that's a big deal. Now, I think it's important also to recognise that people who may decide they don't want to be vaccinated are not evil people. You know, they are not people who should be shown. They're people who make decisions and for whatever reason they may have about vaccination, etc. That's important and that should be respected. Now, fundamentally, this SI I see is about risk. And I see that there's two risks here. One risk is the risk of COVID to people who are living in care settings. And I think that risk is very clear, actually. We've got loads of data on that. We've got loads of data in terms of the impact. We've got loads of data on lethality. We've also got loads of data on the protection that vaccination to people who are at risk of COVID, and also protection of vaccination in terms of reducing transmission, passing it on. So I think that side of the equation, I think, is very clear. The side that's less clear is about the risk to people in terms of staffing. And I think that's really the critical issue here, because there will be people who decide, do you know what, not being vaccinated is more important to me than working in the care sector. And I'm completely unclear as to how many people that's going to be. And I don't think anyone really knows what that population is going to be, what the numbers are going to look like. And that's a concern. We've already got staffing issues in the care sector. This has been a long-term thing for many, many years going forwards. Nevertheless, I think perhaps the only way to test this out is to test it, to bring it forward, to see what happens. I think the 16-week run-in makes a lot of sense, but I think what is critical is that it is monitored and is looked at in terms of what happens with regards to staffing retention. And if it is a big issue, if pressures in terms of retention do start going through, then we have to have a change of course. And I'd welcome if my honourable friend the Minister can say something up, what she's going to do over the course of the summer in this being brought up to work and engage with people in the social care sector on the impact of this being brought in, and if there is a substantial impact, that she'll come back before the House after summer recess with plans to mitigate this or change of course. Thank you.
It is a pleasure to follow my honourable friend, and indeed my honourable friend before him, two learned medical practitioners who, with the underlying qualities that seem to attract to those positions, state their arguments in the finest tradition of the empirical method. Now, as ever, Mr. Deputy Speaker, I can be forgiven for not quite being as rational as the two previous speakers. I hope that the House will indulge me, because I, frankly, Mr. Deputy Speaker, am in despair. You could perhaps have a painting next to me of Munch's The Scream and get towards the feeling that I have over the conduct of government business in this House. The government, Mr. Deputy Speaker, is treating this House with utter contempt. 90 minutes on a statutory instrument to fundamentally change the balance of human rights in this country is nothing short of a disgrace. The fact that no impact assessment exists, and I contend that it does not exist, and if that is proven to be the case, then I'm afraid my right honourable friend, the Minister, will be in a tricky position if she contends it does and it doesn't. That too is a disgrace. Now, the measures before us are in themselves entirely impractical. We've heard already about concerns about the workforce. And I'm afraid, and I have the utmost respect for my honourable friend, and he knows it, if we were to follow his suggestion, I fear that it would be far too late to repair the damage done to the workforce of carers in this country. I think it's an insult to care workers in this country that all they merit is 90 minutes on a motion that nobody here seemed to know anything about last week, but which we're discussing this afternoon. Meanwhile, so many of our colleagues, presumably because of the proxy vote system and the fact that they find it generally inconvenient to be a Member of Parliament, will know nothing at all, will know nothing at all about these measures upon which they are voting. That too should concern us a great deal. I have absolutely no doubt that I will vote against these measures if that hadn't been made clear, Mr. Deputy Speaker, from my remarks so far. 1898, I believe, was the last time that vaccination was mandated in this country. And following that mandation, the rates of vaccination fell. That should tell us all we need to know. We give succour to lunatics and crackpots who advance ridiculous theories about vaccination if we mandate the vaccination. The triumph of the vaccination programme has been the act of kindness that people have felt towards their fellow citizens in doing so. We will lose that goodwill if we mandate it. I had a lady who called me a week or so ago, and she was in tears on the phone. She has a condition that involves blood clots, and she associated the news about two of the vaccines with her condition. She's a care worker. She was distraught. She now equates her illness, the vaccination, the fact that she can't get a GP appointment to discuss it, but that's a different matter. She now equates that with losing her job. Is that what we're prepared to do to our fellow citizens as a Conservative government? Absolute lunacy. You'd expect this in a communist country, which partly explains why so many of our Eastern European fellow citizens have the scepticism that they do, because they know the nature of the state and how it can be perceived as being malevolent. This instrument is an abomination. It should be withdrawn, and the government should stop treating this House with contempt.
It won't. Minister.
Thank you, Mr. Deputy Speaker. And can I thank honourable members for their contributions and the questions they have put to me during this debate. Can I say that I welcome the consensus on the importance of protecting care home residents, and the fact that this debate is actually about how we best do that and the level of evidence needed in order for us to take the steps that can be taken to best protect those vulnerable residents. The problem we face is that the clock is ticking towards winter and a potential combination of COVID and flu, to which we know care home residents will be extremely vulnerable. And the problem with inaction and waiting for more time is that inaction costs lives. Now, I have heard, I assure honourable friends on this, I've heard the strength of feeling about the impact assessment. And can I say that I apologise to my honourable friends for the error, particularly in the explanatory note to the regulations. And I have done my utmost, and I did in my opening speech, to set out to honourable members the situation with the impact assessment. And there isn't anything further that I can say on that now.
Can you just give way about the
Oh, I'll give way to my right honourable friend.
I'm grateful. I don't know whether other colleagues do. I find it quite offensive that because we've expressed concerns about these regulations, we're somehow implied that we want to do away and we want to risk the lives of people in care homes. These regulations don't come into force for 16 weeks. There is ample time to take them away, review them, publish the impact assessment and get this House to make a decision and protect people before the onset of the winter. To suggest that members want to do otherwise and we're suggesting inaction that will put their lives at risk is offensive, and I urge her to withdraw it.
Well, Mr. Deputy Speaker, I mean, clearly no offence was meant on my part. The problem with what my right honourable friend is suggesting is that if there is a substantial delay, for instance, to the autumn in bringing these legislation through, then that leaves care workers who've not yet been vaccinated with very little time in which to get vaccinated. And that is why we are bringing these forward at this point. I'm sorry, but I'm conscious of the time ahead of me. Now, several honourable members have argued that we should continue the current approach to increasing uptake and indeed do more. And I will say that, of course, we will continue to support care workers to take up the vaccine. But, in fact, as flagged by my honourable friend for Winchester, the question is, how long do you give that? Vaccination of care home workers in England began in December last year, around 8 months ago. And we did, in fact, take a similar approach to that mentioned by the member for Central Ayrshire in Scotland, where staff were vaccinated alongside residents in care homes, and NHS teams went into care homes multiple times to offer the vaccination to staff, and indeed we saw that that was effective and more staff took up the vaccination on subsequent visits. We've also opened the national booking system clearly to care home staff, and that was opened up early on before to the more wider availability to everybody. We've worked with communities who've been particularly concerned and hesitant about the vaccination. There have been materials clearly in multiple languages. We've worked with faith groups. Local authorities have worked closely along with the NHS vaccination teams, particularly with care homes that have had lower vaccination rates. There is a huge amount that has been done to raise the levels of uptake amongst care home staff. And then you have to ask yourself the question, what more can we do? And so the number one reason that care home staff have given us that they haven't yet been vaccinated is that they want some more time. Well, this does give them some more time through the summer in which to get vaccinated. Some care homes, as I've mentioned, are already doing this, and one example is Barchester Care Home Group, where they have over 16,000 staff, and the vast majority, over 99%, have chosen to be vaccinated. Fewer than 0.5% have chosen not to be vaccinated. But the problem, if this is left for care homes who are on the front foot to do, is that others will be left behind, and we will see the inequality where some residents are fortunate to be cared for in a care home where all the staff are vaccinated, and others will not be so safe. And that leaves us with the inequality for those care home residents who will remain at greater risk. And we do know that not only does the vaccination protect individuals, it reduces the risk of transmission. Now, some honourable members have raised concern that care workers are being singled out in some way. That is not the case at all. This is about the setting, care homes, where we know there is the greatest risk and the greatest vulnerability to COVID. And this is about protecting those individual residents in those care homes by requiring vaccination for people who are entering those care homes to work. And so that is not only care home staff, it also includes NHS staff who are entering care homes. So it is about protecting the residents in those care homes. So that the rates are fortunately at the moment much lower than they have been during the peak times. But I will say that even in some of the recent outbreaks that we have seen in care homes, the index case has been an unvaccinated staff member, and that just emphasises the importance of us having high levels of vaccination amongst staff. My honourable friend asked me about the data I referred to earlier on, and the SAGE data about the minimum levels and the extent to which that is being achieved by care homes. And I will say I shared the most recent data that I have. And what we do know is there are still hundreds of care homes who have not yet met that safe threshold, which is a minimum threshold for avoiding outbreaks in care homes. So I say to honourable friends, the question before us is what more can we do to protect those who are vulnerable in care homes? Mr Deputy Speaker, this is what we can do, and I commend these regulations to the House.
The point of order is going to have to come, I'm afraid, after... No, the point of order will have to come after the division, I'm sorry. Under the standing order now, I must put the question. The question is motion number 6 as on the order paper. As many of that opinion say aye. Aye. Of the contrary, no. Aye. Division, clear the lobby. The question is motion 6 as on the order paper. As many of that opinion say aye. Aye. Of the contrary, no. No. Tell us for the ayes, David Ratley and Maria Caulfield. Tell us for the noes, Sir Christopher Chope and Sir Charles Walker.
Lock the doors. I'll call you straight after the result. Order. If members could resume their seats. Order. Order.
The ayes to the right, 319. The noes to the left, 246.
The ayes to the right, 319. The noes to the left, 246. So the ayes have it. The ayes have it. Unlock. Point of order. Sir Chope.
Thank you, Mr. Deputy Speaker. Point of order. Mr. Deputy Speaker, I was chairman of the Procedure Committee for 7 years, and it is absolutely incumbent on government not to mislead the House and behave honourably at all times. This explanatory memorandum is a parliamentary paper laid many days ago. It has been well rehearsed in this chamber, but it needs to be rehearsed again. It clearly states a full impact assessment has been prepared and will be submitted. Not is being prepared, has been prepared. Mr. Deputy Speaker, through your good offices, can I ask that Mr. Speaker and the Clerk of the House conduct an investigation into this memorandum to ascertain whether the House has been misled by the government and whether the Minister's conduct at the dispatch box was good enough this afternoon.
I thank the honourable member for his point of order. As I said earlier on, totally unsatisfactory situation, irrespective of whether anybody has been misled via the statement on one of the official documents. The Treasury bench will have heard the point of order he has made, and that will make absolutely certain that it gets through to the department, but I will, as he has asked, raise it at the prayer meeting tomorrow morning with Mr. Speaker. Thank you very much. Point of order, Sir Christopher Chope.
Mr. Deputy Speaker, it always used to be the convention in this place that if a minister was unable to answer all the questions that have been raised in a debate, the minister would offer to write to those honourable and right honourable members whose questions hadn't been able to be answered in the time available. Bearing in mind the sort of cavalier way in which government ministers seem to be treating the conventions of the House, I wondered whether it's within your offices to be able to put pressure on the government to restore that convention of a matter of courtesy. I look particularly at my honourable friend, the member for Altrincham, and said he had a really pertinent question which could have been answered in 2 words. It wasn't answered, and I'm sure that his constituents, on behalf of whom he spoke, will feel really aggrieved about that. So why can't this place restore some sense of reasonableness and good manners?
I'd like to thank the honourable member for his point of order, and I've been a member of Parliament for 29 years, and many times at the end of debates when ministers have said that they cannot deal with each of the points that have been raised, and we were under time pressure today, as has been pointed out by a number of members. Therefore, there would have been a number of questions that had gone unanswered, and I'm sure, again, that the Treasury bench will have heard the point of order and will bring it to the attention of the Minister in order that she is able to give the answers to those questions that went unanswered in the summing up.